Welcome back. In this video, we dive straight into some of the most important topics about diabetes, including long-term complications of diabetes, the best diets for diabetic patients, effective diabetes management strategies, and the overall prognosis of diabetes. Understanding these aspects is essential for preventing serious health problems such as heart disease, nerve damage, and vision loss. Whether you are living with type 1 diabetes, type 2 diabetes, or prediabetes, this video provides practical insights and tips to help you live a healthier life. Long-term diabetes complications. Blood glucose levels that remain high for too long can damage your body's tissues and organs. This is mainly due to damage to your blood vessels and nerves, which support your body's tissues. Cardiovascular heart and blood vessel issues are the most common type of long-term diabetes complication. They include coronary artery disease, heart attack, stroke, atherosclerosis. Other diabetes complications include nerve damage or neuropathy, which can cause numbness, tingling, and ear pain. Nephropathy, which can lead to kidney failure or the need for dialysis or transplant. Retinopathy, which can lead to blindness. Diabetes-related foot conditions, skin infections, amputations, sexual dysfunction due to nerve and blood vessel damage, such as erectile dysfunction or vaginal dryness. Gastroparesis. Hearing loss. Oral health issues, such as gum periodontal disease. Living with diabetes can also affect your mental health. People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. How is diabetes diagnosed? Healthcare providers diagnose diabetes by checking your glucose level in a blood test. 3 tests can measure your blood glucose level. Fasting blood glucose test. For this test, you don't eat or drink anything except water. Fast for at least 8 hours before the test, as food can greatly affect blood sugar. This test allows your provider to see your baseline blood sugar. Random blood glucose test. Random means that you can get this test at any time, regardless of if you've fasted. A1C. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. To screen for and diagnose gestational diabetes, providers order an oral glucose tolerance test. How is diabetes managed? Diabetes is a complex condition, so its management involves several strategies. In addition, diabetes affects everyone differently, so management plans are highly individualized. The 4 main aspects of managing diabetes include blood sugar monitoring. Monitoring your blood sugar glucose is key to determining how well your current treatment plan is working. It gives you information on how to manage your diabetes on a daily, and sometimes even hourly, basis. You can monitor your levels with frequent checks with a glucose meter and finger stick or with a continuous glucose monitor, CGM. You and your healthcare provider will determine the best blood sugar range for you. Oral diabetes medications. Oral diabetes medications taken by mouth help manage blood sugar levels in people who have diabetes but still produce some insulin, mainly people with type 2 diabetes and prediabetes. People with gestational diabetes may also need oral medication. There are several different types. Metformin is the most common. Insulin. People with type 1 diabetes need to inject synthetic insulin to live and manage diabetes. Some people with type 2 diabetes also require insulin. There are several different types of synthetic insulin. They each start to work at different speeds and last in your body for different lengths of time. The 4 main ways you can take insulin include injectable insulin with a syringe shot, insulin pens, insulin pumps, and rapid-acting inhaled insulin. Diet, meal planning, and choosing a healthy diet for you are key aspects of diabetes management, as food greatly impacts blood sugar. If you take insulin, counting carbs in the food and drinks you consume is a large part of management. The amount of carbs you eat determines how much insulin you need at meals. Healthy eating habits can also help you manage your weight and reduce your heart disease risk. Exercise. Physical activity increases insulin sensitivity and helps reduce insulin resistance. So regular exercise is an important part of management for all people with diabetes. Due to the increased risk for heart disease, it's also important to maintain a healthy weight, blood pressure, cholesterol. The prognosis outlook for diabetes varies greatly depending on several factors, including the type of diabetes, how will you manage the condition over time, and your access to diabetes care, your age at diagnosis, how long you've had diabetes. If you have other health conditions. If you develop diabetes complications, chronic high blood sugar can cause severe complications, which are usually irreversible. Several studies have shown that untreated chronic high blood sugar shortens your lifespan and worsens your quality of life. In the United States, diabetes is the 8th leading cause of death. A large number of people with diabetes will die from a heart attack or stroke. However, it's important to know that you can live a healthy life with diabetes. The following are key to a better prognosis: lifestyle changes, regular exercise, dietary changes, regular blood sugar monitoring. Studies show that people with diabetes may be able to reduce their risk of complications by consistently keeping their A1C levels below 7%. How can I prevent diabetes? You can't prevent autoimmune and genetic forms of diabetes, but there are some steps you can take to lower your risk for developing prediabetes, type 2 diabetes, and gestational diabetes, including: eat a healthy diet, such as the Mediterranean diet. Get physically active. Aim for 30 minutes a day, at least 5 days a week. Work to achieve a weight that's healthy for you. Manage your stress. Limit alcohol intake. Get adequate sleep, typically 7 to 9 hours, and seek treatment for sleep disorders. Quit smoking. Take medications as directed by your healthcare provider to manage existing risk factors for heart disease. It's important to note that there are some diabetes risk factors you can't change, such as your genetics, family history, age, and race. Know that type 2 diabetes is a complex condition that involves many contributing factors. A diet for diabetes involves eating a balanced diet rich in non-starchy vegetables, fruits, whole grains, lean proteins, and healthy fats, while limiting sugary foods, drinks, processed grains, starchy vegetables, and high-fat items. Key recommendations include eating at regular times, controlling portions, for example, the plate method, and choosing foods with high fiber content, like whole grains and legumes, to manage blood glucose levels effectively. Foods to eat: non-starchy vegetables. Fill half your plate with these, such as spinach, broccoli, cucumber, and bell peppers. Fruits: choose whole fruits over juice, as they provide fiber and nutrients. Whole grains: opt for whole wheat bread, brown rice, oats, and quinoa instead of refined grains. Lean protein: include fish, especially oily fish like salmon, skinless chicken, turkey, beans, lentils, tofu, and nuts. Healthy fats: use olive, canola, or sunflower oils, and eat avocados, nuts, and seeds. Low-fat dairy, milk, yogurt, and cheese in low-fat or non-fat versions are good choices. Water: make water and sweetened tea or coffee your primary beverages. Foods to limit or avoid: sugary foods and drinks. Cut back on candy, cookies, cake, sugary cereals, juice, and regular soda. Refined carbohydrates: limit white rice, white bread, white pasta, and other processed grains. Starchy vegetables: consume starchy options like white potatoes, corn, and peas in moderation, as they are high in carbs. Unhealthy fats: avoid foods high in saturated and trans fats, such as fatty meats, full-fat dairy, butter, and fried foods. Processed foods: minimize consumption of packaged foods, fast foods, and foods with added salt and sugar. Tips for a diabetic diet: practice portion control. Use the plate method. Half your plate non-starchy vegetables, a quarter lean protein, and a quarter whole grains or starchy foods. Focus on fiber. High fiber foods help regulate blood sugar. Eat regularly. Maintain consistent mealtimes to help prevent blood glucose spikes and drops. Be mindful of drinks. Avoid sugary beverages. Choose water and sweetened tea or coffee instead. Read labels. Check food labels to identify whole grains and avoid hidden sugars and fats. Limit alcohol. If you drink alcohol, do so in moderation. Eat food with it and monitor your blood glucose levels. When should I see my healthcare provider? If you haven't been diagnosed with diabetes, you should see a healthcare provider if you have any symptoms of diabetes, such as increased thirst and frequent urination. If you have diabetes, you should see your provider who helps you manage diabetes, such as an endocrinologist, regularly. Being diagnosed with diabetes is a life-changing event, but it doesn't mean live a happy and healthy life. Managing diabetes involves consistent care and diligence. While it'll likely be very overwhelming at first, over time you'll get a better grasp on managing the condition and being in tune with your body. Be sure to see your healthcare provider regularly. Managing diabetes involves a team effort. You'll want medical professionals, friends, and family on your side. Don't be afraid to reach out to them if you need help. Did you learn something new today? Drop a comment below. Hit that like button, share with friends, and subscribe so you never miss an update.